Good morning, I'm Dr. Jim Lynch from Spine Nevada. It's a pleasure to be with you this morning at the SOTE International Weight-bearing Conference. I'd like to share with you our experience at Spine Nevada in using the SOTE G-scan and highlight the comparative advantages in surgical planning. Regarding disclosures, I have no disclosures. I have no financial interest with the SOTE. I just happen to really like the company. I like their technology and their quality and their service. And over the last 5 years, I've purchased 3 MRIs from them. And it's the reason I'm here this morning is really share our experience with it and how happy we are with it. Spine Nevada is a multidisciplinary spine center based with neurosurgeons, physical medicine doctors, physical therapists, and we have a large emphasis on our imaging center where be it MRI, vertebral motion analysis, and full digital scoliosis films. And this really has helped us over the years and be a full service spine center and a musculoskeletal center. We're part of an IXE healthcare group which encompasses Spine Nevada, Vein Nevada, Swift, and Spine Nevada Direct, which we'll speak about. I'd like to just kind of show you this slide I've made up, Hollywood squares. We all know this from the old days, but I've used this to highlight some of the advantages I think that our practice has on what we strive for, and we're making clinical decisions and investment decisions. And this is used for our staff. If we look at it, the X is the important part of the game, if you like, to control it for patient satisfaction. So how do we get there? So we need to have access, number one, and we have developed that with Spine Nevada Direct, Swift Urgent Clinic. And then we also have to have low cost of care in a delivery of care in the in-office facilities, injection suites, and clearly in-office imaging and in-office MRI has been a huge advantage for us. We measure outcomes, and we've been doing that for over 15 years, and that's important when you try to talk about quality. You have to demonstrate that, and this ultimately leads to patients, increased patient satisfaction, which is the goal here, and this has been really behind most of our major decisions in the practice as we've expanded over the last 15 years. Tenet number one, access. As we said, Swift Urgent Clinic is a musculoskeletal, orthopedic, sport and spine clinic for a walk-in. Spine Nevada Direct is really an appointment based for mainly spine patients. We use this very effectively when patients apply for an appointment, so they seek a referral. And many patients don't come with imaging, and this is a perfect portal for us to get the patient in soon and have appropriate imaging. We really explain to them as they've contacted the practice that we're happy to perform their imaging if indicated for MRIs and X-rays and really give them a full service. And this has been a huge advantage to us. Patients' satisfaction is really very high on that, and it's a huge part of our success going forward. Cost, clearly lowest cost of care. If we want to shift the cost curve, practice itself is doing that. In-office injection suites and in-office imaging, it is a huge way to reduce costs for a healthcare system. This benefits the patient, the healthcare system, the insurer, and really has been rewarding all around. Outcomes we've been demonstrating are outcomes to employers, to insurers, and obviously to patients and our referral providers over the last 15 years to good effect. And then we've really highlighted our quality and in making capital investments such as the MRI, the G-scan that you see here. It really has been a cornerstone and a backbone to our practice. As seen here, this patient, this is an open MRI. Patients like it. They're less fearful of it. We've reduced the amount of patients that need sedation and hence another cost saving. But the fact that the MRI is in our office, it's behind glass walls, patients after an appointment in the clinical side, they can just be walked over and then just shown the MRI that you're going to come back tomorrow or next few days to have your MRI. And that brings down the fear factor. They're not going to an institution or a hospital that they're not familiar with. And really that anxiety that occurs before getting an MRI is markedly reduced. They've seen it, they can feel it, and it really has helped us decrease the amount of patients that are claustrophobic and can't have the MRI itself. So there's a major advantage in that respect. Patient satisfaction, again, has been increased significantly by having all services on site and a really one-stop shopping for them. We've trademarked the term InMotion Diagnostics, and this has really helped us differentiate ourselves in our market in the Northern Nevada region by having the highest quality of care with a very unique and distinctive imaging capacity. The Esote G-scan or Brio, we have 2 of them in each of our Sparks and Reno location, and they've really set the bar, if you like. They're truly unique, practice differentiator, not seen by regular MRIs in the hospital and the other imaging facilities in the region. And patients' uptake for them has been very high, and the providers that we work with have been very pleased with it to date. We work with another modality called vertebral motion analysis, and really use this to look at sagittal balance and deformity in general, and the whole issue of motion and how that affects the spine. And we interpret the 2 studies together in addition to full series digital scoliosis standing bending films. And this, we feel, has given us a platform and a really truly unique high quality service for the patient. This is demonstrated here with a cervical MRI, which can be a flexion extension MRI, the vertebral motion analysis, and the digital scoliosis films. We also have the Esote O-scan for musculoskeletal patients as well, for upper extremity and lower extremity imaging, which we use. I've taken a scan myself for a shoulder here. It's an open scan, and oftentimes patients have a cervical radiculopathy, and the insurance is trying to rule out, is there a shoulder pathology here as well? And oftentimes they'll request an MRI of the shoulder to rule it out. And if we have it available so easily in our center, it works best for patients and for the insurance company, and it's very convenient for them. The advantages of the G-scan weight-bearing shown here, really a very positive patient experience. It's dramatically different for the patient. If you really interview a patient who's had truly a standard MRI and the closed tube, and you interview them after they've had an open G-scan MRI, the experience is vastly different, and they really just sing its praises, and then they go on and tell other patients in the community for sure. And we've really grown that over the last 5 years, and hence the reason that we added a second one 2 years ago. Access, truly at this stage, we try to keep our access open, and we like patients to be scheduled out no further than 2 days if we can. 2 to 4 days is about average. If it gets longer than that, I think at that stage we'll probably look at adding another MRI to accommodate that need. We're really redefining the imaging itself and interpreting spine motion, and truly the way that allows us to get better results in surgery, more accurate diagnosis. And this has been a game changer for our practice and my partners, both on the surgical side predominantly, but also on the pain management side, to get an appropriate, accurate diagnosis and target the lesions. This also has been hugely seen for patients who have metal artifact. The artifact is far less in those patients, and we certainly follow a lot of patients who have had prior surgery in the lumbar spine or cervical spine, and with the lower field magnet, this has been hugely advantageous in our practice. We have a full capacity connection with our PAC system, which really allows us to use our own customized programs on the Esote system. We're not relying on outside systems, and we have a better measurement and a better ability to use the full functions within our own system, as opposed to trying to learn 100 other systems that are out there. And this has been huge for really deformity planning. And there's nothing worse than showing up in the hospital and you can't open an outside film, or you can't use all the keys that are in there for measurements, because oftentimes when you have access to an outside company, you're really limited in the tools that they allow you to use. The O-scan is shown here for really for a comprehensive look in our practice. So really, we didn't want the extremities to decrease the access for the G-scan, so we added the O-scan for the extremity examinations, and this really has been helpful. The field strength, if we look at the MRIs themselves, for our practice, it would make no sense at all to invest in a 1.5 brand new MRI or a 3 Tesla. It's just not what we need to do. But the Esote G-scan has been perfect for our practice. It really has allowed us to look at the anatomy itself and interpret it, to the best that we need for surgical planning. And we've been very satisfied with the quality over the last 5 years, my partners as well, and we've had no issues with that. We've worked very well with the radiologists and our radiology MRI technicians to really tweak the programs and get the best out of the system that we can. Regarding Milliman guidelines, it's been very helpful. We submit the guidelines on complex cases, and we fill out the patient's need for surgery quite well, but in conjunction with the MRI report. When we have an accurate MRI report that shows weight-bearing changes, and whether it's increased ligament compression or collapse from the lordotic aspect of weight-bearing, this really has helped us in getting patients approved over the years. Minimally invasive spine surgery is a huge part of it in our practice, and if we can really target the lesion and keep it simple, oftentimes we're limiting the levels that we need to perform surgery on, both in the lumbar spine and certainly in the cervical spine. And this has been a huge advantage over the years of ruling out levels as opposed to trying to add levels to your surgery. Obviously, cost and outcome are huge if we look at it in the healthcare spectrum, and this MRI has really helped us in our practice, and we've been able to talk to insurance carriers and really providers and educate them as our role in the cost equation and value-based care, and this factors in quite well with us. This demonstrates the slide here, the increased ligament compression posteriorly on the nerve roots with a spondylolisthesis. I'm shown here with the grade 1 spondylolisthesis, and this is just a lot more augmented and easily seen when the patient is in weight-bearing and loads. And the standard saying is, patients don't hurt so much laying down, but they hurt when they stand up, and this is a part of it. And we use this for demonstration purposes with the patients. We educate them as to the advantages of the MRI, and we show them a little video of their disc herniating if they have a posterior lateral disc, and we show this in a bone model as well, and the two correlate quite well. A couple of case studies showing a far lateral disc herniation on the left here, showing compression of the left L5 nerve root that wasn't revealed so well on the supine MRI. A lateral disc herniation up here at L3-4. Cervical MRI, again, has been very helpful with the Esote Brio. Really shows the dynamic nature of the disc and the spine itself. Oftentimes we see spinal cords with a concavity that really hasn't been explained before in a supine MRI because there's CSF in front of the spinal cord. Whereas when we have the patient studied with the Esote G-scan, we can see the dynamic component where the spinal cord is really draped over the offending disc anteriorly, and that's really helpful in our surgical planning, demonstrated here. Patients experience, patients are really show that, again, the pain is worse when they stand up and relief when they lay down. The spinal cord, as we discussed there, was more compressed. And overall, European studies in particular have shown upwards in 30 to even 40% increase in spinal pathology with weight bearing than compared to a standard supine MRI. Patients and doctors, referral doctors, are really delighted to really understand the etiology of patients' dynamic symptoms. This has been borne out over the last few years in our practice. All our providers, whether they're physical medicine physicians or the surgeons themselves, have been really happy and with the outcome of the studies and the interpretation of them. If we understand the treatment better as a result of accurate diagnosis, we're going to have better outcomes and more cost-effective care, and less likely to have inappropriate levels done or wrong diagnosis. Keys to success: clearly in future, factor into your investment the number of studies you're going to do, the cost up front, without question, and then clearly the maintenance. We've been very satisfied over the last 5 years with the low maintenance costs of the G-scan compared to our colleagues with an open MRI or that have far higher costs. Insurance negotiations have been very good with us. We've highlighted the differentiation of the G-scan compared to ordinary scans, and we've been able to recoup more cost-effective rates from them, understanding the difference that really the patient's getting 2 MRIs. We avoid multi-scans in the same day and contrast studies. And again, MRI is not a simple volume commodity. It's really specific for targeted diagnosis, and it facilitates our practice and doing that, and it really helps us with the clinical diagnosis and subsequent treatment, whether it's the pain management side or the surgical side. Provider education is huge. In addition to patient education, we spent a good deal of effort educating the providers and the patients on the advantages of our Sote G-scan. So thank you very much. It's been a pleasure. I'm sorry I didn't make it down to Florida.